About the complementary therapy of bay leaf and basil leaf capsule as antiglycemic agents. That's me and all of my team. Okay. For the introduction, we focus with the type 2 diabetes mellitus, a global health problem with high prevalence. In Indonesia also, so many cases about the diabetic mellitus, diabetes mellitus type 2 also. And then we focus with the second therapy, it's often not fully with effective. And in this research, we focus with herbal-based complementary therapies as incredibly popular. And bay leaf in this study, we focus with two types herbs, that bay leaves and basil leaf. It's potential for antiglycemic. Why? Because in Indonesia, so many people using this bay leaf and basil leaf for making the food, something like that. Okay, for the objective in this study, to evaluate the antiglycemic effect of bay leaf and basil leaf, and we make it into the capsule as a complementary therapy in patients with type 2 diabetes mellitus. For the methods, this is study we're using the RCT with double-blind randomized control trial design to evaluate the antiglycemic. Okay, I will explain about how to really blind this RCT. First, we don't know the research don't know who will get the placebo or who will get the intervention capsule, and this is will doing by the pharmacist to give it the code. But before that, we will do the randomize with computer generate using the Excel, and then the pharmacy will give the code for all of the type capsule. And we don't know who will get the capsule or placebo to the patient. This research we do in the Talang Jambi Community Health Center, and we have 150 respondents. We divide into one group control and then intervention control. In intervention, there is 75 respondents, and control is 75 respondents also. And we carry out of over 8 weeks intervention between April 7 and June 7 in 2025. The target population consists patient diagnosed type diabetes mellitus, but there is no complication with it. So just total diabetic mellitus type 2. And then this is for the inclusion and exclusion criteria. We just take in around 30 until 65 years diagnosed with type 2 diabetes mellitus, at least 6 months, and then fasting blood glucose, it's more than 126, and willing to provide informed consent. So they need to stop about the standard therapy first, at least in 8 weeks for this intervention. And then the pregnant for the exclusion, we don't join with pregnant or breastfeeding woman, patient with liver or kidney failure, or use of herbal supplement before, with at least 1 month history of allergic reaction also in with exclusion of it. This is the intervention group receive capsule containing a combination by basil leaf and bay leaf. It consists with 500 milligrams, and they will take it in twice a day. This is the process we make it the capsule. We join with the pharmacy faculty in UNS. This is the process. We buy the bay leaf and then we process it, and then we process into the capsule like this. For the outcome in this study, we focus with this fasting blood glucose or FBG, and then 2-hour postprandial blood glucose (PPB-AG), and these values were measured at baseline and after 8 weeks of intervention. Okay, for the data collection, baseline demographic and clinical data were collected using structured questionnaire and medical records, and blood sample for FBG and PPBG were obtained via vein puncture and analyzed using standard laboratory methods. This is a result of the study. We using the analyzed US SPPS expression, and then we get the Wilcoxon test first for just one group, and then the next with May test to compare intervention group and the control group. This is the ethic clearance for our study. This is the result. We use the 150% and we divide into two groups, intervention and control respondent. This is the result. Okay. Just a minute. The findings are consistent with previous. So the capsules so effective to reduce the hyperglycemia in patient diabetic mellitus. Okay. Thank you.